Hospitals and their staff say they are fighting to keep good health care, but that the governor's plans make that impossible.
Chief Political Correspondent Mark Davis joins us live with more. Mark.
Hi, Sonia and Darren. Good evening, everyone from the Hartford Newsroom. Now that the big battle over gun control is over at the state capitol, the big battle over the budget gets underway as the governor tries to close that gap, $1 billion in red ink. Hundreds of doctors, nurses, and administrators from across the state jammed into the legislative office building with a simple message: that the $550 million in cuts in their state funding proposed by Governor Malloy in his austerity budget will be devastating to health care.
Resources will be taken away from the patients at the bedside.
They say that further staffing and program cuts will result because the hospitals are already operating very close to the edge. The most impassioned plea came from Andy Hull, the Danbury Hospital nurse who sustained 3 bullet wounds from shots fired by a dementia patient with a gun in the emergency room 3 years ago.
Everyone out of this state that will ultimately have someone in their family that's sick, and one day they will be sick, and they will appreciate the fact that there's someone there to hold their hand at the bedside.
This is part of the money hospitals get from the state that helps to pay for patients with no insurance.
Those cuts will affect care at the bedside. Make no mistake. And anybody who says that that's not the case isn't telling the truth.
But the governor says it's the hospitals that aren't telling the whole story.
What's happened is hospitals have gotten used to a 24% increase in funding per year, and we can't afford it.
Malloy also says the hospitals will make up the difference as more and more people become covered by insurance next year under the Federal Affordable Care Act, also known as Obamacare. Malloy says hospitals should look to cut CEO pay.
Many of them are making in excess of $2 million, many of them more than $1 million. You look at the top 10 at each hospital, what they're making, citizens would be astounded.
Now, over 3 months of legislative time was burned up and used in the aftermath of Sandy Hook. Now, the gun part of that is now concluded, but some people at the state capitol are saying that the 8 weeks that remain in the legislative session may not be left to deal with this budget gap. Live from the Hartford Newsroom, Mark Davis, News 8.